Ice massage is a technique that we use quite commonly for treatment of inflammatory conditions in children where the problem lies close to the skin. The technique involves taking a piece of ice and something you can use as an insulator. So most often just a face cloth with an ice cube in it. The face cloth is to keep the child's fingers from freezing. The ice cube is going to go right directly on the skin. So take the ice cube in the face cloth. The ice cube is going to go right on your skin, and you're going to rub it with a fair bit of pressure on the area that's painful. You're going to do this for about 5 minutes, no longer. We use it often in and around the knee joint, and sometimes also down around the heels, where a lot of children, when they're growing rapidly, get heel pain. So it's basically ice cube in a face cloth. The surface of the ice goes directly on the skin. The face cloth keeps the child's fingers from freezing, and you're going to massage the painful area for about 5 minutes. The more you do this, the better it works. If you do it once or twice a day, the condition gets better, but it takes a while. If you can fit it in 4 times a day, even 6 times a day, the condition will get better faster. This is a technique that we use in young people to promote good posture, a more upright posture with a straighter back. And it involves the use of kinesio tape, which is flexible fabric tape. What I'm going to do is use a small piece and try to place it between the shoulder blades so that it makes the child want to pull their shoulder blades back together. If they round their back, the tape pulls. So it's a little bit of a biofeedback mechanism to promote straighter posture. So I'm going to ask our patient to roll his shoulders forward. So he's technically not in great posture. Then what I'm going to do is anchor the middle of the tape in between his shoulder blades. It's a fairly easy landmark to find. The shoulder blades stick out when you round your shoulders forward. So I'm going to stick the middle of the tape right on the spine in between the shoulder blades. Make those shoulders nice and round. Then what I'm going to do is give the tape a bit of a stretch as I push it forward outwards across the shoulder blades. Round your shoulders, I'm going to stretch the tape and pull out. If you rub that tape a little bit, the glue on it is heat activated. It tends to stick a bit better to the skin. Always sticks better to cleaner skin. Okay, so now let your arms just relax down by your side. And the effect should be to pull those shoulder blades back together closer and have a more upright posture. And that tape should stay in place for 3 or 4 days, even with showering, and then it can be changed. This is a kinesio taping technique that we use in young people just to help them feel like their kneecap is tracking better as they bend and straighten their knee, relieve some of the grinding, grating, and painful symptoms they get with patellofemoral syndrome. It's a very, very simple technique. Sometimes we'll teach the athletes to do it themselves. You want to place your patient with the leg out straight, but not locked straight. That's why I have my knee just under my patient's knee to keep it bent just slightly. You want to find the patient's kneecap, cut a piece of kinesio tape that's going to span their kneecap and extend slightly on either side. And what we're going to do is just tape upwards on the medial side of the kneecap, trying to catch approximately the medial third of the kneecap as we come up. I'm going to put very, very little stretch on the tape. This is really just to catch that inner part of the kneecap. And really, instead of coming in exactly a straight line, I'm going to attempt to put a little bit of a C-shaped curve on this. So I've anchored my tape down low. I'm going to stretch slightly, catch that medial third of the kneecap, and come up above there in a bit of a C-shaped arc. If you rub that tape a little bit, once it's been applied, the glue gets activated a bit better and it'll stick for longer. In most cases, we suggest this tape can remain in place for 2 or 3 days, even with showering. So I've just caught about the medial third of the kneecap, and what we want this to the effect we want to have is to hold that kneecap over a little bit and relieve some of the symptoms of patellofemoral disease.